Great Lakes Academy Learning Lab production. Common speech and language disorders. Articulation is the process people use to produce sounds, make syllables, and pronounce words. It includes everything from tongue placement to how the lips move. A person with articulation disorder may have trouble pronouncing words or speaking clearly. This is typically most evident in certain sounds like replacing TH with S or R with W. One example of articulation might be that you have a student who is difficult to understand at times because he replaces the L sound in words with the W sound, such as in I love going to the wake on the weekends. So if you have a student who struggles with articulation in the classroom, there's a couple of things that you can do. So first of all, modeling proper speech production is going to show them auditorily how to say those words. That's really important. And it's even okay to correct their mispronunciation of a word as long as it's productive and positive. You can also allow the student some time to express themselves. They might stutter or they might have trouble getting their words out, and it's okay. It's okay to have some patience there and let them express themselves using the time that they need. Also, another helpful thing might be if they're going to present in front of a group, it's a really good idea to give them some adequate practice time in small groups before they go in front of the class. And I think going along with that is some praise and positive reinforcement for their participation on something that might be tough for them. Pragmatics is part of social communication disorder, and pragmatics refers to using language in the proper context. So for example, it's important for children to develop the ability to use language differently when playing with a younger child versus communicating with the teacher. So what might you see in a student who struggles with pragmatic skills? First of all, responding to others, using gestures with their hands, taking turns when talking or playing, talking about emotions, feelings, staying on topic, adjusting speech to fit different people or situations. For instance, talking differently to a young child versus an adult, asking relevant questions or responding with related ideas during conversation, using words for a variety of purposes, such as greeting people, making comments, asking questions, making promises, and making and keeping friends. Pragmatics in the classroom, let's say that you have a student who's highly interested in superheroes and often wants to talk about them. Use opportunities during break or lunch or recess to engage in small talk with the student. If they try to drive conversation back to superheroes, then you can try one of the following. So for example, you could say, I love superheroes too, but we talk about them a lot. Let's talk about our pets. Or you could say something like, I really like talking superheroes with you, but can we also talk about how things are going in our lives to practice our conversational skills? For our students, it's really important that they practice the conversational skills outside of their norm because sometimes they do get stuck in a loop on their favorite topics. So doing this will help them to practice those necessary skills for everyday life. So expressive and receptive language disorders. Let's talk about expressive. When you have somebody with expressive language disorder, they struggle to communicate their message when they speak, so expressing themselves. Receptive language disorder has to do with somebody who has difficulty understanding the meaning of what others are saying. And it is possible to have mixed receptive expressive language disorder. So individuals can have expressive or receptive, or they could have both. So let's talk about some examples of what you might see with a student who struggles with expressive and or receptive disorders in the classroom. So for example, with expressive, when called on, a student has trouble expressing how they feel about a text that they read. They might have trouble, just getting started, getting the words out, and you might even see it manifest in that when they retell a story, they're telling it the parts out of order. And for receptive, a student may have difficulty with the oral directions in the classroom, especially if there were multiple steps involved. And this might be a student who just is, after the directions, they're just sitting there because they aren't sure what to do with those directions. They didn't quite understand everything that was stated. So now we know a little bit more about students who struggle with expressive and receptive disorders. So what do we do in the classroom to help them out? So with expressive, we can be sure to allow the student time to formulate their verbal and written responses. Also, if a student is unclear in their expression, ask them to restate it. If necessary, rephrase their response stating, "Do you mean?" Modeling clear and concise language. Receptive, some ideas there would be, for example, chunking information so that students are not overwhelmed with too much input. And then always give oral instructions paired with visual instructions to aid the student in understanding what to do. I think it's important to provide those visual instructions and train the student to go back to them if they find themselves struggling. And you're always going to want to put those directions in the same place, whether it be something you post on Google Classroom or something that is written on the board. It's a good idea to have something that they can go back to if they're not sure about instructions. Some final thoughts. Language is paramount to our interactions at home and school. If we have a better understanding of what our students struggle with, we can better serve them in our classroom. Our understanding and interventions will aid them in their development socially and academically. And finally, working with students with learning difficulties requires patience, effort, and education. Thanks for doing your part to help out your students. I'm Michael Charles, and I am the educational diagnostician at a wonderful school in Plano, Texas called Great Lakes Academy. It's an excellent school choice for students with a learning difference or diagnosis, which can make learning in the traditional large classroom challenging. If you found this video useful, please give it a like and subscribe, and look for more informative content from our channel.